All right, welcome everybody. We're so glad you're here today. My name is Sharon Dornberg-Lee. I'm a clinical social worker and I'm the clinical director of community services at CJE Senior Life. And this is our monthly Insights on Aging program. It's a pleasure to welcome you. And our topic today is making good decisions about taking medication. Our speaker today is Christine McCall of JCFS Chicago. JCFS is Jewish Child and Family Services. They're CJE's sister agency under the JUF umbrella. And Christine is an LCSW CADC, which means she's a licensed clinical social worker. She's a mental health specialist, and she's a CADC, which means she's also a substance use specialist. She is the addiction recovery specialist with JCFS Chicago. And before I hand it over to Christine, I have just a few housekeeping notes. This series is sponsored by CJE's Counseling Services Program. And we want to be sure that everyone is aware that we offer counseling services via telehealth or in person in our Rogers Park and Deerfield offices. We provide individual, family, and group therapy. We have a wide variety of support groups. If you want more information about any of these services, call us anytime at 773-508-1000, and we'll be happy to answer any questions you may have. If there are professionals in attendance today, I just want to let folks know that we don't offer CEUs for this community education program, although you're most welcome. We also want you to be aware that we have a live CART transcriber providing closed captioning today. That's Heather. You can't see her, but she's there providing live closed captioning. And if you'd like to see that feature, you need to turn it on manually by selecting the CC live transcript icon at the bottom of your screen. And then you can either select subtitles or full transcript and adjust the font size to fit your needs. Finally, this program is recorded and it will be available later on our website. So in order to protect your privacy for that recording, we're using this webinar format, which again means that unfortunately we can't see each other, but please do use the chat feature or the Q&A feature to pose questions and comments during this program. We really want to hear from you and want this to be interactive. So with that, I'm going to turn it over to you, Christine. Welcome and thank you.
Thanks, Sharon. Thanks everyone for being here. It's a beautiful day, and so I really appreciate taking time out of that to hear about this really important topic. So we're going to learn today about how to make really good decisions about our medication, how this specifically impacts older adults. Just kind of to preface that some of this information might be new to you, some it might be a refresh, but I do like to kind of give everything from the basics, just because I don't know who knows what on this presentation. So just to get us started, I wanted to make sure everyone's aware of JCFS and what we provide to the community. So our mission is that we support individuals and families struggling with or in recovery from addiction and work with Jewish community to create compassionate responses to addiction's many challenges. What we also offer through addiction services at JCFS, professional trainings, community education like this, support for individuals and loved ones, information and referral for community, and consultation and resources for Jewish staff. We are not a treatment facility, so we don't directly provide substance use treatment. However, we do have a consultation line that if you are concerned about yourself or a loved one or a colleague, you're welcome to call in and we can kind of help understand what's going on and offer the recommendations. So our agenda for today, we're going to start off talking about why this matters, specifically why this is so important for older adults. We're going to then talk a little bit about substance use, misuse, and abuse. And we're going to wrap up with how to empower yourself and others in regards to taking ownership of your own medication management. So again, this is probably not meaning to insult anyone's intelligence. This is probably known, but just in case there's someone in this room that it's not, I think it's important to talk about. So as long as I take my medication, it doesn't matter what time I take it. True or false? I wish we had an interactive presentation, but for the sake of today, it's not. That is false, of course. It does, of course, matter what time. Certain medications impact you differently at different times of the day. So it's really important to be mindful and attuned to what these specific recommendations are on your prescription. On the days when I wake up feeling good, I don't have to take my medication. True or false? Of course, that's false. It's important to always take your medication through the course that was recommended. And I had that same cold last year, so I can use the antibiotics I had left over for this cold. Of course, that is false. We want to be mindful of the expiration date. Of course, there's a million different antibiotics, and even if you think it's the same cold, you might need a completely different course of medication. So adults, this might not be as known. Adults over the age of 65 who are healthy and do not take medications should not have more than one standard drink on a given day. True or false? What do you think? True. So the CDC has defined that one standard drink per day for adults 65 and older is recommended if they are not taking any other medication. What they've determined is any more than that amount could greatly increase your risks for adverse consequences. And one drink, if we're in person, I do a little show and tell what that means, but one drink is a lot less than you think. For instance, if you're enjoying a glass of wine with dinner, that one standard drink is only 5 ounces of wine. So if everyone at home, if you do drink wine tonight, get out your measuring cup, measure out 5 ounces just to kind of see what that's like, because it is shockingly less than what you think, and certainly less than most pours at restaurants. Older adults should not drink at all if they are taking certain prescription medications. You want to be really mindful about what types of medications you're taking and how they may interact with alcohol. Have medical conditions that be made worse with alcohol. Are planning to drive a car or engage in other activities that require alertness and skill. Of course. What do we think the answer is? Of course, it's all of the above. So we want to be, as we know, alcohol is a depressant. It's a respiratory depressant. So it's going to make you feel lower, a little more relaxed. And so if you're taking medication or you have a condition where you're already feeling that way, this is just going to exacerbate those effects. Okay, I found this from the Mayo website. Many things get better with age: wine, cheese, wisdom, but unfortunately, the liver is not one of them. And that's why I'll go into here why as we age, we can't have as much alcohol as we once did, for instance, in our earlier years. So there's specific reasons why the experts recommend that no more than one standard drink per day. And essentially it's these 4 pillars. There's, as we age, there's decrease in body water, there's decrease in liver function, there's decrease in kidney function, and increase in body fat. So with the liver and kidney, as our metabolism slows down, so does that processing. So let's say in your younger years, if you were to have just kind of a simple rule of thumb is your liver essentially metabolizes 1 drink per hour. But as we age, that can slow down. And so it takes the liver longer to process that drink. And therefore, if you're used to going to dinner and having 2 glasses of wine as you're waiting for dinner, those are just kind of compounded together. Your liver is having to work harder at metabolizing that alcohol. So you're going to feel the effects even greater. There also, their changes result in the elevated blood alcohol levels for a longer period of time. And so just keeping in mind that these are very real reasons that are happening as we age, and therefore we have to be more cognizant of our alcohol intake than maybe we were before. So typically, not always, but people do tend to take more medication as we get older. Part of aging well is, making sure that we are in touch with our doctors, our specialists, and making sure that we're exercising and our body is operating as good as it can, which sometimes that means taking medication to help that. So taking medicine prescribed by your doctor is usually safe and effective. But again, as we age, our bodies change and we handle medicine differently than when we were younger. And so if as you were younger, you were used to taking, for instance, an antidepressant daily, and you still would have an occasional drink, you may notice that as you're getting older and continuing that same antidepressant, that you're feeling more tired, more lethargic, and thinking, well, what's happening? I've been taking this forever. And it's essentially these metabolic changes as we age, that the medicine is affecting you and the alcohol is affecting differently. So, and again, just I really want to emphasize that with the liver and the kidneys, because the slower metabolic rates, any substance is staying in your system longer, and it's just taking more care to flush them out. So why might older adults not take medication as prescribed? It's, you might often wonder what could be the reason for that. And there's a couple of things that can impact this, and particularly older adults. If you have any memory related issues, you could forget to take them. You could also just get busy. Oftentimes, I know that I should put my medication in a pill box, because after being busy the whole day, I sometimes have to take a pause and think, did I take that or not? I don't want to double take it. So I'll just wait till tomorrow. Well, that's not good either. So if we're not kind of cognizant about setting up these reminders or a system, it's a very easy thing to just forget to take them. Obviously, our eyesight is not what it was for some people, and so it can be difficult to read the directions on the label, or we might just get complacent and not read them. They don't understand how the medication will help. So if we don't know how something will help, then why would we do that? So if you go to your doctor and they're and oftentimes doctors are very busy and they're double booked, triple booked. They might not be going over all of the medication and why it could help. And if we're not our own advocates and we don't understand how it will help, that might just be another pill that we keep in our medicine cabinet and forget about. Fear of side effects. Those are real. You see the commercials on TV, you look at the prescription slip from Walgreens, and there is a half a page of the potential side effects, and some of them are really scary. And so this is why it's important to know them and talk with one-on-one with your doctor or pharmacist about what is the reality of me experiencing this, what should I be looking out for, not letting that fear necessarily dictate whether or not you take it or not, but getting more information, which leads to lack of information from the care team. I've been through my own health concerns, and it's shocking. You assume that your doctors, their specialists, they're all talking to each other. You don't have to pay attention because they're doing all the stuff in the back end, and that just doesn't really happen. We really have to be our own advocates and ask the questions and be prepared for our visit, which I will give you some tips and tricks later on in the presentation. Okay, so I am a substance use specialist, licensed clinical social worker. I've been specializing in addiction related issues, whether that's anything from misuse, education to people who are really needing help. So I think it's important to talk to everybody about the risks, particularly with this age group. So I'm going to show a video that will get this conversation started.
NPT reports, aging matters.
Thousands of people dying.
The overdoses of the synthetic opioid fentanyl have increased exponentially.
A trial date is approaching for makers of opioids.
The most comprehensive lawsuit yet against opioid manufacturers.
It's everywhere. Almost any American will know
One of
people.
the biggest health threats we are facing today is the opioid crisis.
A perfect storm of science, suffering, and sales strategy over 2 decades is what we now call the opioid epidemic. It has taken years to see this storm coming, a staggering increase in addiction and deaths numbering more than 700,000 in the United States, according to the Centers for Disease Control. And the biggest percentage increase is among adults age 55 to 64.
My name is Jim Owenby. I'm from East Tennessee, and I believe my mother was overprescribed opiates that caused her death.
Jim Owenby's mother, Laura Strange, was taking prescription opiates and other medications for blood pressure and depression when her memory and behavior began to change. At the time of her death, pharmacy records show Strange was getting 180 oxycodone tablets about every 30 days.
When you realize there's an issue, the first signs of it, then you definitely need to go into, private detective mode, or just say, I want to see your purse. Just kind of like with your kids, Well, it's the same with your elderly parents as far as with medications.
We often don't think about older adults as becoming addicted to opioids. Physicians often undiagnose or misdiagnose the problem because sometimes the symptoms of opioid addiction look like other things, things like confusion, depression, for example. We recommend that all older adults keep an up-to-date medication list of all the medications they're taking, and that list should be shared with all physicians that are seen by older adults, because this is a way to ensure that each physician understands the medications that others are prescribing.
So that video, I believe it was 2020 when that was released. It's, older. But unfortunately, I still, in my practice and work, still see this to be true. There was, the opioid epidemic really did, the population it really didn't highlight or draw attention to was older adults. And I think that was a huge mistake, because there was no other population that may be more at risk. As we age, we have increased difficulty sleeping, we have increased pain potentially, and the go-to prescriptions for these tend to be opiates, sleeping pills, and benzodiazepines. And they are highly addictive medications. They are only intended to be taken for really short periods of time, unless it's with careful consideration with your doctor for chronic pain management. And unless we're aware of this, if your doctor is giving you a prescription, let's say you had a back injury and PT is not helping and Advil is just not cutting it, your doctor may give you a prescription for Oxycontin or Percocet to help with the pain management. And unless your doctor is clear with you about the cost benefits of the addiction potential, you may not understand. And the problem with opiates is that they are very effective what they do. They will help with the pain, but you build up a tolerance pretty quickly. And so if you're relying on that for the pain, pretty quickly you will start to find that you'll need more of it. And this is where we see people getting into problems. So I want to make sure everyone kind of has an understanding of what are problematic prescription drugs in relation to addiction potential. So there's two classes of drugs. There's opiates and there's benzodiazepines. Again, opiates are typically used for pain management. I just gave it, there's more, this list is not exhaustive, but I wanted to give you examples of what were the common ones that you'll see prescribed. And then benzodiazepines help with different things, but mostly anxiety. They can be prescribed for acute anxiety, going through a loss, for instance, that you're having a hard time sleeping. Your doctor might prescribe you Valium or Xanax to help. And I'm not saying that they should never be prescribed, but being aware that if you're going through something that's really hard and you need extra help, it really should be limited to short term. And when you're with your doctor asking, if, for instance, they just wrote a script out for Xanax, having a conversation about, what's the length I should be taking this? When should I be concerned? What are the signs that I should be getting concerned if I'm building up a tolerance? So prescription drug use problems happen all the time. They happen to everyone at every age, every demographic, and it doesn't discriminate. And so it's important to be aware of when should I start being concerned? When should I start maybe talking to a professional to get some help? So sudden change in behavior, if you've noticed for yourself or maybe a friend, if they're acting unusual, if things just seem off and there's not an explanation for that. Obviously, if you're dealing with a loss or you're dealing with a difficult situation, that doesn't mean that necessarily there's a prescription drug use problem, but you want to be mindful of that. Withdrawal from family, friends, and activities, people who are misusing their prescription drugs, they're constantly in this. The problem with especially opiates is that the tolerance builds quick and the physical withdrawals are horrendous. So withdrawing from an opiate, if you are dependent on it, there's going to be a lot of nausea, a lot of GI issues, vomiting, anxiety. And so if you're constantly kind of chasing the how do I get more prescriptions and dealing with withdrawal, of course you're going to be withdrawing from your friends and families. Rapid increase in the amount of medicine that is needed. So if you find yourself, or if a friend's talking with you that, doctor gave me Vicodin for my back pain and I was taking, 2 a day, but it's just not cutting it. I think I need to up to 3. That is a sign that you should pretty quickly reach out to your doctor to get some advice, to have some help with getting off of it and exploring other options. And frequent refills. This is in every pharmacy now. The one thing that was good that came out of the opiate epidemic is that pharmacies, there's a lot more guardrails placed that you can't refill that prescription unless it's the monthly date. And when you start negotiating with your pharmacist, your doctor for more, that's a sign that you may have some concerns with that. Doctor shopping, it's people who are really in their addiction, might be going to different doctors or specialists and not disclosing they're on this. Luckily, again, since the epidemic, there have been some policy and guardrails set in so that doctors are more connected than they were before, so that they're aware of what other physicians are prescribing that patient. So the question, okay, if you're sitting here and your interest is peaking and you may be concerned, or it might remind you of someone, what do you do about that? So first of all, it's not on, if this is for a loved one, this is not on you to fix, solve, or manage. We all have to have our own boundaries around that. Ideally, getting them to talk to a doctor, counselor, other mental health professional. Again, I want to put a plug for JCFS Addiction Services. If you're sitting in this Zoom room and this is applying to you, reach out to us. Happy to consult, talk about, even help give the language that you could use to a loved one if you're concerned. Encourage them to be honest about exactly how they're taking their medications. Doctors, counselors, we can't help unless people are being honest. And I do understand the hesitancy. There is an incredible amount of shame and stigma attached to addiction, particularly with older adults. It's a really hard thing to work through, and that's why it's important to have a really good care team that you feel safe and comfortable with. Talk to a trusted caregiver about your concerns. So if it's a friend and you know this friend has a caregiver that you trust and feel safe with, and you're just kind of noticing some things with them, it's perfectly okay to talk to that caregiver if you have that relationship about maybe some concerns that you have. So almost every presentation now, it doesn't matter if I'm talking to teens, if I'm talking to college age students, or I'm talking to older adults, I'm always talking about naloxone and giving a quick, very brief training. And the reason why is because opiates and unintended overdoses happen to everyone, no matter what age group it is. And I think that we don't necessarily talk about Narcan with older adults because we just assume that Narcan is for heroin addicts. But as you just saw with that video, unintended overdose of opioids happening to older adults happens all the time. And so what is Narcan, naloxone? It is a life-saving medication. It temporarily reverses an unintended or intended overdose of opioids. So what it does is if you were having a overdose from a prescription or non-prescription opiate, like a pill, Percocet, Vicodin, it will put you into withdrawal almost immediately. And so it essentially will bring you out of the overdose. You still need to call a medical professional to get vitals checked and make sure if you need any other medications, but it will get you out of that. There is nothing else that you can do if you or a friend was going through a opioid overdose. That is the only thing that will save your life. It is non-harmful. It is non-addictive. If you, for instance, if a caregiver found their loved one unresponsive and they knew they were taking Vicodin for some back pain, if they were concerned and they gave them the Narcan and it turns out they had low blood sugar, blood pressure, and it wasn't because of the opiates, it wouldn't affect them negatively. So that's why it's really important. I know people are a little nervous about this medication still, and I think there's still some stigma attached, but it really, there is no adverse consequence to taking this, and it is the only thing that will save your life if you're going through an overdose. I recommend that we think about naloxone just like we do with everything else. Put in your first aid kit. Make sure that if you do have a caregiver or you are a caregiver, make sure the whole unit in your family knows how to use it and knows the signs. And just like everything else, we put things in our first aid kit that we hope we never use. But when we need it, it's important that it's there. So there is a very short 2-minute video. This I like to show this because people still get a little nervous about, well, if I have the box, how do I use it? And it is so simple. And this is a really great 2-minute instruction about how to use it quickly.
Narcan nasal spray is an emergency treatment designed to rapidly reverse the effects of a life-threatening opioid emergency. If you suspect an opioid overdose, check to see if the person will not wake up, is very sleepy, or is not breathing well. Do not test the nasal spray device before use. Narcan nasal spray is for use in the nose only and is safe to use even if opioids are not present. Hold the nasal spray device with your thumb on the bottom of the plunger. Insert the nozzle into either nostril and press the plunger firmly to give the dose. One nasal spray device contains 1 dose of medicine. Call 911 immediately after giving Narcan nasal spray. If the person does not wake up, continue to give doses every 2 to 3 minutes until the person wakes up. It is safe to keep giving doses. Stay until an ambulance arrives, even if the person wakes up. You have the power to save a life. For more information, visit Narcan.com.
Hey, it's really that simple. You can get Narcan at any pharmacy without a prescription. They're usually sold behind the pharmacy desk, although you don't need a prescription. I think at Walgreens, they're like $44. You can also get them at any Chicago public library, health clinics, Erie Health Clinic. I don't know if the Levy Center or other senior centers have them, but essentially any health clinic or community clinic that you're at, ask if they have Narcan, if you want to get it for free, and have a first aid kit. Okay, so what about marijuana use? I think this is also important as we talk about alcohol. Marijuana, cannabis is also legal for adults, and people are using it for different things, and it's important to think about how that's going to affect your prescription drug use. So just there are still many people who think that cannabis is completely non-addictive, that it causes no problems, it's a safe alternative to pain, and that's just not true, because marijuana, just like alcohol, just like anything else, really depends on the person and the reason. And so some people choose to use marijuana to help with certain medical conditions, to help relax, use it recreationally, and it's fine, and it doesn't cause them any negative effects. But there are people who it does not work for, and so really wanting to think complexly about that. So we see in the data that cannabis use is increasing with older adults at a fast rate. Some potential complications include chronic respiratory conditions, depression, impaired memory, altered judgment and motor skills, and dosage and mixing, particularly with alcohol, greatly increases the complications. So the difference with marijuana now versus marijuana 20 years ago, even 15 years ago, is that the potency is way different, way stronger, and there are a lot of different options. So a lot of people are, and older adults in particular, are really interested in the edible varieties, because it makes sense. You don't have to smoke. You don't get the same carcinogens as you would with vaping or joints, and so it seems safer. And I guess from that perspective, it is. But edibles are highly potent, and it takes a while for them to take effect. So for instance, if you're taking an edible and you don't feel anything, and you take another edible, that compounded effect will greatly increase. And taking an edible, you should know that it takes about usually an hour and a half to fully feel the effects. And so if you are taking it, be very mindful and go very slow. Before, I always recommend with everyone, but particularly with older adults who have other medical conditions or or prescriptions, talk with your doctor first, weigh out the pros, cons. And I know there is stigma around it still, but it really, the more that we're talking to our doctors about what we're using both prescribed and recreationally, they can help us make informed decisions. And pay attention to THC content. If you're getting marijuana at a dispensary, it can vary wildly from a lower percentage, like 1% THC, to I've seen upwards of edibles that are 20% THC. And so the more THC in it, it has more active effects. And so that's when you see people getting into trouble, because they start feeling racing heart rate, they start feeling anxious, they start feeling paranoid. So you really want to be cognizant and careful, and be open with your doctor before you're using marijuana use, either recreationally or medicinally.
We've got a question, and I thought I would just hop in. I don't know if you prefer to take it later. We got a couple questions, but I'm not sure if there's a typo here, or if the person is asking something that I'm not familiar with. But it says, how do you determine the combination of medication? And I'm not sure if they mean vitamins, but what it says is VHITS MIBS. So Roberta, who asked that question, I don't know if you want to just put in the chat. Is that an acronym? I don't know, or did you mean to say vitamins and medications?
So how to determine the combination between vitamins and medications?
I think is the question.
That's the question?
I believe so, yes.
Okay. Yeah, I mean, I think bringing that everything to your doctor, including, that's a really good point. I'm glad Roberta brought that up, because many people use supplements, and we know that supplements aren't regulated in the same way that prescriptions are. And so we have to kind of do the pros cons of that as well. So bringing all of your prescriptions and medications to your doctor's appointments so that they can help you decide. For instance, if you're taking Synthroid for thyroid disorder, you can't take a multivitamin. I think it's 4 to 5 hours within that time period. And so you want to have a schedule of when you're taking your medications and your supplements. Hope that helps. Was there anything else, Sharon?
The other question was, what are the best medical websites for drugs, for basic medical drugs? They said, do you have any recommendations of where people go for reliable and authoritative information?
As far as, I'm assuming like interactions.
And they didn't specifically say that, but I think it'd be helpful.
Okay.
Not just interactions, but like, how do I know what the side effects of this might be?
Yeah,
or
that's
what's the recommended dosing if I'm unsure about that, if it's OTC or
right.
Anything else that you might want to know about your medication?
Sure. A great question. I think the best recommendation is pharmacists and doctors. Pharmacists might be probably more accessible than, you don't have to wait on your doctor. I think those should be the first line of defense. But I do know of a couple that are pretty comprehensive. I'll follow up with that with the resources that we send out after. Okay, let me just make a note. Okay. All right. So, and we will have some time at the end for some questions. So I'll finish up the rest of this content and we can follow up with that. Just briefly, is it a problem? When we're thinking of everything, unproblematic use versus problematic use, we want to pay attention to how am I using it? Why am I using it? And is it getting in the way of anything? And being honest with ourselves and others about getting help around that. Okay, so now I'd love to leave you with some tips, some tricks that may seem common sense, but I think that we often don't think about them. So I want to make sure that everyone has these with them. We will also send, when we follow up after this, we will send a couple of handouts. One is a medication checklist, some guides that can be helpful to take to your doctor. So don't worry about having to write down these tips. We'll send them out. Okay. Again, if you're not sure how to take a medicine, ask your doctor or pharmacist. I love to use, I think, finding a pharmacy that is not overloaded, which is difficult these days, but that you know that there's a pharmacist available and who will take their time if you have questions. I think that's a really great resource to have. So feeling comfortable with that. Ask your doctor and pharmacist about the side effects to watch out for in interactions with medications. This is where being our own advocate and not being afraid if they tell you it's fine, don't worry about it, pushing back a little bit to ask these questions, because it is your right as a consumer and patient to have that information. Ask how the medicine will affect driving and other daily activities. Very important, particularly with medications like opiates, like benzodiazepines, and particularly if you are combining them with other supplements, alcohol or cannabis. Talk with your doctor before you change a dose or stop taking medicine. I know this can be tricky, particularly if you're having really negative side effects, or you're not sure if it's working and you're just tempted to just stop. But we just don't know how that withdrawal will affect us. And so really, really try not to stop that before talking to your health provider. Do not crush or break pills without checking with your doctor or pharmacist. Some pills are the dosage is so particular that even breaking pills may alter the dosage. And so wanting to check with your doctor, for instance, if you're taking, I had a client who was taking a antidepressant, and really just their system was very sensitive to the side effects. And so they put them on a very slow taper up. And so making sure that before you stop taking it, or you break it, or you do that on your own, you get a prescribed taper or amount from your doctor. Do not use someone else's medicine. And I know this is something that everyone knows that they shouldn't do, but we still find people doing that. And again, we don't know when it was expired. We don't know how, if we haven't talked to your doctor, how this is affecting your other medications. So really being sure not to do that. Don't share your medicine with anyone else. Don't mix your medicines with alcohol. And obviously the official recommendation is not to mix medicines with alcohol and cannabis. The harm reduction recommendation is if you are someone that does drink or enjoy alcohol, and you don't necessarily, it's not problematic for you and you don't necessarily want to give that up, talk to your doctor openly about it. What would it be like if I drank on this? What were the negative? And then making that decision with your healthcare team. Some that might help your doctor give you something else that metabolizes through the kidneys and not the liver. So being open and honest, and we all get to make our decisions based on what we want for our lives and our bodies. Don't be afraid to help organizing your medicine. So it can be very overwhelming the more we get. And I don't know about you, but sometimes it's tempting to just shut that medicine cabinet and wait for another day to deal with it. And it's okay if it feels too overwhelming for whatever reason. Ask a friend, ask someone you trust to come over and help. Schedule a yearly medication checkup with your doctor and pharmacist. Just you know, as our bodies change and our metabolism changes, so does the effects of the medication. So wanting to make sure it's still working for us the way that it should be. So a good thing with to think about doctor is, what is the purpose of this visit? So before you go to your doctor appointment, you know, I really recommend coming in, writing down, having a notebook about what everything you're hoping to get out of the visit. So we have to be prepared ourselves, because oftentimes you see, particularly if our doctors are double booked or running late, if we're not asking the questions, they're not necessarily offering it. And so really coming in, knowing what you need and to get out of that appointment. More than one reason for a visit. So maybe there is, you're struggling with multiple things and you need multiple visits to get those needs asked. Don't be afraid of asking and really advocating for what you need out of your healthcare provider. Again, write down the questions for your doctor. It's easy to get, it's easy to forget in the moment what we wanted to come in with. Don't let the doctor rush the exam. Easier said than done, I know. But, you know, we need to make sure that we deserve to feel heard, to be seen, to be taken seriously. And if that doctor is, if we don't feel like they are being attentive to our needs, it's maybe time to explore what are some alternatives. Prepare a list of medications, dosages, and instructions. This will be one of the handouts that we give later, so that you're walking in with your sheet of all your medications, the dosages, and places for you to kind of write notes. So this is so important because, and I know all doctors' offices have electronic health records. They have systems where this information is already there, but we never know if you know, things get passed by or get forgotten about. So it's important that we come in as prepared as we can. Take in all prescription bottles. So if you don't want to make a list of it, don't be afraid of just bringing in all your prescription bottles, setting them out so that your doctor can go over with you. And this is a great question from the woman that asked about supplements. This taking your supplements as well, and your doctor can go through which prescriptions can be taken or not with which supplement. Take someone with you. So not being doctors, especially if we're dealing with complex and multiple health disorders, it can be really overwhelming to do. We don't have to do this alone. Sometimes bringing an advocate, bringing someone with you is helpful. And particularly if you know with yourself, I mean, I'm one of these people, I like to be compliant with the doctor. I don't want to ruffle any feathers. I know that, and I know that I can get in my way of being my own advocate. So if there is an important meeting that I want to go to, I'll bring my husband, because I know he will ask the questions that maybe I don't feel like I can or should. And have names and contact information for other prescribers. So your whole bringing that list of, here's my care team and they prescribe X, Y, and Z. Again, these are just some tips about some questions you might want to prepare before. Any questions you have about any of your disorders, disease, or symptoms of medicine, the need to continue, non-drug treatments. This can include supplements or any other type of treatments that you're currently receiving, over-the-counter preparations, and do you need follow-up appointments, lab work, etc. Always keep an up-to-date list of your medications, prescriptions, and over-the-counter. Take your medicine list to all your medical appointments, doctor, dentist, emergency room, hospitals, share with your pharmacist. I think dentist is an important one here because that can be an overlooked healthcare provider in regards to prescriptions, but certainly dentists do prescribe medications for certain things and may get treatments while you're at the dentist that may negatively or adversely affect what you're taking. So that's very important too, and certainly the emergency room. And so when you have that list and you, your caregiver, your family, your friends know where that is, that there's not a even discussion about, you grab that list or the binder and you're going to the emergency room so that they have all that information. Again, take your medicine exactly as prescribed and only use the medicine for the reason it's prescribed. If you're prescribed Xanax for flight anxiety, don't use that for, I had a hard time sleeping, right? Really reach out to your doctor for something that could help with the thing that you're looking for help with. Okay, so we have about 7 minutes for any questions or housekeeping tips.
So we do have just one question that we haven't already responded to from Michael. What is the best and safest way to dispose of outdated or expired prescriptions? Great question.
And such a great question. And that will also be sent out in the handouts that we have. There are certainly pharmacies, Walgreens have those, like, I don't know, those like little safes, right, that you can just drop off prescriptions. However, they often, I don't think ever actually take controlled substances like opiates or benzodiazepines, which I think there must be a reason for that, but it's kind of silly. So there are different programs and drug disposals and drug take back programs that will be sent out with links of where to access that in your area. But great question.
I would just add to that, since we're also talking about mental health today, we're sponsored by our counseling services program. I do recall having a client who was having some fleeting thoughts of self-harm. And we talked about just all this medication that she had, you know, kind of not used over the years and was just sitting there. And we jointly thought, let's just get it out of here, because sometimes people act impulsively in a way if they're feeling really down. And I brought it to CVS for her. I don't remember, I don't think there was any kind of a restriction on what you could or couldn't put in this big CVS. And so I just put that whole big bag of all her expired medications, and I think some were benzodiazepines from years before. So double check that maybe the next time you just happen to go to the drugstore and see if there are any restrictions on what they'll take at the CVS or the drugstores. It was just like a secure bin that you could drop old medications in.
Oh, that's great. I will do a quick plug. I forgot to mention earlier when we were talking about medication safety about the importance of having a lockbox at home. So a lockbox is it's exactly what it is. It has a combination that you can put your more, I guess, controlled substances like sleeping pills, benzos, opiates, not necessarily for yourself, but, you know, if you have grandkids that are coming over, if you have neighbors, friends, it's just a really good idea to keep those and any cannabis locked away so that people can't access them.
I was going to add too, for those of you who may have services through the community care program, which is free in-home help for older adults who qualify financially or on the lower income range. One of the benefits of that program is you can get a medication dispenser for those who are feeling forgetful, or just like me, I take like one pill a day and I still forget it sometimes. That is sort of, I think the model that they have is like a drawer, so you load it with your medications, or a trusted caregiver loads it, and then the drawer slides out at the designated time and dings, and that helps you keep track of your medication so you don't overtake it or undertake it. And you can purchase those too if you're not part of that program. It's called a medication dispenser. We're about out of time, and I do have a couple of quick housekeeping items. I don't see any other questions. So first and foremost, we want to thank you, Christine. That was just so much really valuable information. You covered so much in a short time. So thank you for being here. That was wonderful. I also want to thank all of you for being with us today and for being active participants in our program today, which makes it so much richer. Thank you for being here.